Hi guys, this is for the ladies. I'm Dr. Amy Killen, and I wanted to talk about female sexual dysfunction slash stress urinary incontinence. Now this is two different things obviously, but I'm putting them together in one talk because the treatments that we can offer can be overlapping or the same. So I'm talking specifically about regenerative treatment options that use things like radiofrequency devices or laser, vaginal lasers, or pelvic floor strengtheners in combination with stem cells, exosomes, and PRP injections to improve the overall health of the whole system down there. So what kinds of things do we do? So women who have sexual dysfunction, things like vaginal dryness, vaginal laxity or looseness, problems with orgasm, decreased sensation, or stress urinary incontinence. So that's when you jump on a trampoline or you cough or you sneeze and you pee a little bit, but it's not too bad, sort of mild to moderate, SUI we call it. These are all cases that could benefit from a combination of something like an O-shot, which is going to be injecting things like PRP with or without stem cells or exosomes, plus something like a vaginal laser or radiofrequency device. So things like the FemiLift or the Vivive, and I have both of those machines. But basically you're creating a little bit of damage using heat or light with the laser or the device, and then your body's repairing that damage over the course of a few months to have stronger area around the vaginal tissues, better support for the urethra, you can get better lubrication, you can get tightness, you can get improvement in sensation. And then the O-shot is just into the clitoris, and that's as well as the anterior vaginal wall, but it's more sort of the external structures of the vulva than going deep into the vagina. But the O-shot can also be really helpful, again, for people who are having problems with pleasure or orgasm and want to have a little bit more sensation, more blood flow to that area. So I like to combine these things. Other things to think about in these patients are increasing nitric oxide. So there's some supplements you can do, or you can also do changes to your diet, because nitric oxide is responsible for blood flow. You want blood flow into that area for sure. And especially if you're a little older, like over 40, which is not old by the way, but if you're over 40, then you definitely want to be thinking about nitric oxide and getting blood flow where you want it. I love the use of a pelvic floor strengthening device like the Intensity device, or Apex device, which are these kind of massive, look at a little bit like, they're kind of big, but they're basically these at-home devices that you can buy for not that much that have a TENS unit almost attached. Like, you know the TENS unit where you put them on your muscle and your muscle like spasms, like so it's kind of like that, but it goes inside the vagina and it stimulates the muscles around in the pelvic floor to contract. So it's like Kegels on super steroids, but it's not painful. You can do 10 minutes a day and over the course of several months make a huge difference in stress urinary incontinence. You can do this at home by yourself. You don't have to really even go out to the doctor. You can buy these devices over the counter, although you should go to the doctor because it's a good idea just to get checked. But I love using all of these things in combination. Hormone therapy, if you need it or if necessary, can be really helpful, as well as some other types of changes to lifestyle if needed. So those are kind of my tips for women with mild to moderate stress urinary incontinence and or some kind of sexual dysfunction, like we've discussed, is using this type of combination of regenerative treatment options with vaginal lasers and devices, with at-home vaginal devices in combination with like nitric oxide boosters and bioidentical hormone therapy. All right, if you have any other questions or want to know more, visit me at dramykillen.com, and that's Killen, and I would be happy to tell you more. Thanks.